Christine, you think about that number. That is such a small percentage of people who had those adverse effects that received the Johnson & Johnson vaccine. Still, this news came as a big surprise to one Nevada family whose 18-year-old daughter still recovering after being airlifted to a hospital here in Southern California.
I sensed a little bit of anger today in that the vaccine is set to be released again.
Anger and confusion. After undergoing 3 brain surgeries, 18-year-old Emma Berkey is still in a Loma Linda hospital weeks after getting her Johnson & Johnson vaccine. Her family spokesman Brett Johnson says neither the CDC or the pharmaceutical company has reached out to the family.
Do they have any interest in knowing, about Emma or Emma's circumstances? And did Emma have anything in common with these other women? Or is there a commonality somewhere that they can identify so that maybe they can keep this from happening to somebody else?
Emma is one of 6 women out of more than 7 million people who suffered blood clotting after getting her J&J vaccine. She's literally a 1 in a million case, but that's hardly consolation for her family.
It's 1 in a million, to the whole population, but it's 1 in 1 to them, right?
The vaccine has been on pause for the last 10 days because of cases like Emma's. But on Friday, the CDC and the FDA lifted that pause and said the label will be updated with blood clot risk warnings.
At this point, I think the benefits outweigh the risks.
Endovascular neurosurgeon Dr. Parham Yashar says the science is evolving constantly, and he believes the J&J vaccine is safe.
It's important to understand that we have a pretty significant and heightened awareness of this issue, which really is important in getting ahead, kind of staying ahead of the curve from the side effects of this vaccine. I think the key thing to understand is that the number of cases or the incidence of this issue have been quite limited. The incidence is also quite rare.
People we talked to were hesitant about whether they'd consider the J&J vaccine now.
I would prefer to do 1 shot rather than 2 shots. So before knowing this, I might get the Johnson ones, but after knowing, no, not really.
Thankfully, Emma is making major improvements.
A big move yesterday happened that she was able to communicate verbally. Her voice is soft, but she can answer questions.
Even after all they've been through, the Berkey family is still urging people to get their COVID vaccines, but to research them first.
Do it. Get vaccinated, but just be careful. And I think it would make common sense. I think they would say it doesn't make sense for women to get the Johnson & Johnson vaccine if there's a choice.
Now, here in LA County, providers who already have doses of the Johnson & Johnson vaccine can start giving them out tomorrow, as long as they also give that updated warning sheet. Reporting live in Westwood, I'm Chelsea Edwards. I'll send it back to you.
Chelsea, thank you.